Up next, we're going to move down the axial skeleton to the neck and learn how to move your neck. So, well, we've learned some of these already, these hyoids and this constrictor. Now we're going to move on to this side of the model and learn these muscles, especially of the posterior neck, that extend the neck. All right, so the first one we need to learn is the sternocleidomastoid, which is a pretty big and very strong muscle. It originates on the sternum and the medial end of the clavicle. Sternocleido is for clavicle. And then it inserts on the mastoid process. Remember, that's on the temporal bone right here behind the ear. So it pulls the kind of the back of the head toward the sternum and the clavicle in the front. Now, the odd function of the sternocleidomastoid is that if you contract only one side of the sternocleidomastoid, it pulls the head, it turns the neck in the opposite direction of the side that you contracted. So try this. Put your thumb on your sternum and your pinky on your mastoid process. And then pull the pinky toward the thumb. So it's going to first pull the head down, but if you keep contracting just on one side, just one thumb and pinky, you're going to turn your head toward the opposite side. Is that odd? Yeah. So that's a cool muscle. It's also very visible superficially. It's a very superficial muscle. So it's one that we can see very clearly on when we're looking just at people. Now, a little posterior and a little deeper are the scalene muscles. We're going to come back to them because they're important muscles of respiration. But they also help to flex the neck because they are going to go from the transverse processes of the cervical vertebrae to ribs 1 and 2. So their main role is to elevate those ribs during inhalation, but they're also going to help to flex the neck, bend your head forward. Now, the trapezius muscle is this big muscle that goes across your back and inserts on the shoulder. It has this really huge origination from the back of the skull all the way down the spinous processes down to Ch11. But it also wraps around to the clavicle. And so when you contract these anterior muscles, these anterior fibers of the trapezius, it can actually extend the neck. It can actually flex the neck as well, depending on which of these fibers you contract. But it is a very important one for stabilizing the neck and turning the neck as well. All right, now two muscles that are big and also help to extend the neck or laterally flex if you contract one side. These are deep to the trapezius, okay? So we only see them when the trapezius has been pulled away, but we can see parts of them otherwise. Okay, these are the Semi-Spinalis Capitis here and the Splenius Capitis here, okay? So these are both work together with some other muscles that we're not going to learn that are deep to these to extend the neck. So they also work with these deeper muscles, which you're not going to learn, okay? These extend the neck. Now, on our models, the trapezius covers all of this up. But here is, this one is one we haven't learned yet. That's the Levator scapulae. It's going to raise especially this medial border of the scapula. This is the Splenius Capitis. Okay, you can see it kind of does a slightly oblique angle, and then running straight down and deep to it is the Semi-Spinalis Capitis. Okay, so that's that there. And then the trapezius would sit superficial to all of that. The sternocleidomastoid has been removed on this side, but we can see part of it here. And then these here and here, those are the scalenes. Okay, so you can see part of them and they're deep to these other muscles. Okay, so hopefully that makes sense. We're going to continue working down the axial skeleton.